Hello angels, welcome back to my channel, and if you're new here, welcome to my channel. My name is addidanielle, and in today's video I am starting a new segment on my channel called Mental Health and Makeup. In this segment I'm just going to be sitting down with y'all, doing my makeup, and talking about a mental health topic. This is inspired by Bailey Sarian's Murder Mystery and Makeup Mondays. She sits down, does her makeup, which she is insanely talented, so I highly recommend watching her, and talks about true crime, and I really enjoy her videos. A lot of people really enjoy her videos, so I thought that I would do my own twist on it and do a Mental Health and Makeup Mondays, because mental health and makeup are two things that are super important to me. Why not combine them? I love sitting down and doing my makeup and chatting with y'all. So let's get started. Today's mental health topic is going to be hypochondria / health anxiety. I thought this topic is really prevalent with COVID going around. A lot of people who maybe didn't already suffer with health anxiety are now suffering with it because of the pandemic, and people who already suffered with it are experiencing it at a much more serious rate because there is a potentially fatal virus going around. People are really afraid of catching it, and it can cause people to overanalyze symptoms, and a lot of panic and anxiety and depression in general has gone up. So I thought it'd be good to talk about today and shed some light and some stigmas and educate a little bit about the disorder. So what is hypochondria? Before the 18th century, it was used to describe a physical disease of the lower rib cage, but we now describe hypochondria as a fear or obsession of an undiagnosed medical condition. About 2 to 3% of the population suffer from hypochondria, and it's equally prevalent in male and female. It's usually between the ages of 35 and 65 that health anxiety really becomes prevalent, but it can happen in children and teenagers and all ages. Some of the symptoms for health anxiety are constantly checking the body for changes, going to the doctor often to be examined, frequently searching the internet for causes of possible symptoms, mistaking normal sensations like twitching as real symptoms, believing that minor symptoms are a sign of a more serious illness, worrying that they'll develop a illness because a family member has it, and becoming preoccupied with the fear of an unknown health condition. So those are some of the symptoms of hypochondria or health anxiety, but it can actually also cause physical symptoms that show up in the body. Some of the physical symptoms of health anxiety are heart palpitations, headaches, dizziness, blemishes or rash, stomach aches, insomnia. There is a lot of similarities between health anxiety and obsessive compulsive disorder. A lot of people who suffer from OCD tend to suffer from health anxiety as well, and vice versa. The San Diego Tribune writes that hypochondriacs often experience physical symptoms that are caused by anxiety. The constant worrying can release harmful stress hormones that end up doing physical damage and creating actual physical symptoms. So a lot of the times a hypochondriac isn't necessarily making up symptoms, they're real symptoms that are caused by the stress of the anxiety itself. So the internet and media has had a huge effect on the way that we view hypochondriacs. It is very often used as a comedic relief in a lot of movies. For example, Madagascar, the giraffe is a hypochondriac, is always thinking it has some sort of illness.
Oh, let's go! Not for me. I'm calling in sick. What? I found another brown spot on my shoulder, right here. See? Right there. You see?
Melman, you know it's all in your head.
Because of that, it has kind of created a stigma around hypochondriacs, that they're just kind of these like silly worry warts, and it's not taken as serious as a real mental illness, which it is. And also just having the internet makes it incredibly easy to look up symptoms and create worries for yourself of things that you didn't even know existed. So WebMD and Google has been a huge drive in hypochondriacs, and we've seen a huge influx since the age of the internet. We are constantly bombarded with ads about getting mammograms and the newest drug and all these things that cause you to worry, and it's no wonder that we're worrying. We can't help but worry when these things are shoved in our face of possible sickness and illness. It's not that these are now more prevalent, it's that the internet is making us more aware of these things. It is a very real and valid mental illness. There is a lot of stigma behind it, but that does not mean that you are not valid in your feelings and that you are not suffering from something that actually exists. Anxiety.org says this term is associated with a lot of stigma. Often people suffering from this disorder feel invalidated and dismissed from health professionals and those in their community because of the stigmatization of this word. The DSM-5, which is the Diagnostic and Statistical Manual of Mental Health Disorders, published by the Psychiatric Association in 2013, removed the term hypochondriac and renamed it with two separate disorders. The first being illness anxiety disorder, which is the one that is more so associated with health anxiety. And the other one is called somatic symptom disorder. And that involves a person having a significant focus on actual physical symptoms. It's somebody who has a real symptom, maybe suffers from migraines, or that has an actual physical symptom such as a pain or a weakness or shortness in breath, and creates a much bigger, scarier disease or medical condition from those symptoms. So they're two different things. A lot of people think that it was unnecessary to separate the two, and it causes people who have the illness anxiety disorder to think to be made out as their physical symptoms aren't real. But they're both very valid and real disorders, and you can suffer from both. How is illness anxiety and somatic symptom disorder diagnosed? A diagnosis is confirmed by a doctor or psychiatrist when fears and symptoms persist for 6 months or more, despite reassurance through medical evaluation. So that's saying you've had these fears and you've gone to the doctor, you've been told that nothing is wrong with whatever the symptom is, and you still are having these persistent fears and worries. And that is when you get diagnosed with either a somatic symptom disorder or illness anxiety disorder, depending on your symptoms. A diagnosis is something that can help a lot of people. Even just realizing that it is a real thing that you're suffering from can cause you to be more self-aware and can make you have some self-reassurance, knowing that, okay, I know I suffer from this illness and I know that it causes me to create symptoms or causes me to hyperfixate on symptoms, and you can almost talk yourself down from that if it's a mild case. There is treatment for illness anxiety and somatic symptom disorder. The main treatment is cognitive behavioral therapy, or CBT. CBT is a therapy model that focuses on our cognition, behaviors, and the way that we act. The main concept of CBT is that our thoughts about a situation affect how we feel and how we behave. CBT aims to help overcome fears by correcting our irrational thoughts and behavior patterns. Cognitive behavior therapy is definitely the first line of defense for someone suffering with health anxiety. It is the most recommended treatment plan and has been found to be the most effective. One thing that's really helped me has been to just learn everything I can about illness anxiety disorder and health anxiety so that I can kind of understand what's going on in my brain and be extremely self-aware and understand, okay, this is not a rational thinking pattern and that it's something I can overcome. Recently, my boyfriend got exposed to COVID through his work. And when we found out, it had already been 6 days since his exposure, so it would have been right about the time that we would have been testing positive. And as soon as I found out that news that we had been exposed, I immediately started feeling horrible. I had a fever, like an actual fever. I had a dry cough out of nowhere. I just started coughing like a dry cough. I was having shortness of breath, and I was like 100% sure that I had COVID. We both went and got tested the next day, and as soon as I found out we were both negative, I immediately felt better. And so I want all of you to know that you're not alone in this. This is something that I experienced. This is something that a lot of people experience, and even though it is extremely stigmatized, it is a real disorder, and there is things you can do to overcome it. SSRIs are another really helpful treatment plan for somebody who maybe is not seeing the results from cognitive behavior therapy that they're wanting. SSRIs like Prozac and Paxil have been found to be really helpful with people with health anxiety. So if you're going to therapy and you're finding that it's not as helping you as much as you would like, I would definitely talk to your doctor about possibly starting SSRIs, seeing what's best for you, trying different ones out. The main thing I want you to take away from this video is to end the stigma on hypochondriacs or health anxiety. It is a real mental disorder. It is in the DSM-5. It is a very difficult thing to deal with, especially in today's day and age with COVID and everything else going on. It can feel very lonely because it's something that not a lot of people understand, but I want you to know that you're not alone. And if you know somebody that suffers with this, I challenge you to be open in a conversation with them about it. I hope that you learned something in today's video. I hope that you enjoyed watching me do my makeup. I didn't mention any products I was using while I was doing the video, so if you're interested in anything I was using, I will link everything below. I hope you enjoy the rest of your day, and I'll see you on the next episode of Mental Health and Makeup.